been warned to get their flu vaccinations after numbers jumped 74% in the past week. Joining me live is infectious disease paediatrician at Sydney University, Professor Robert Booy. Thank you so much for your time. No doubt it's the rest of the country that could certainly be needing vaccinations and the like with the increase of flus and COVID.
Yeah, both of them are surging, and the best way to prevent is to vaccinate so you don't get the illness in the first place. Vaccines are effective. They're probably 60 or 70% effective. So instead of 5 people getting ill, maybe only 2. But they're not perfect. And people like myself who was vaccinated against flu have still caught it because vaccines are not perfect. And so you need to do lots of things to help you protect yourself. Vaccination is one, but keep up with the social distancing, washing hands, masks in crowds, particularly if you're vulnerable. If you're an elderly person who's got a major heart or lung problem, vulnerable people are especially getting ill and dying of COVID and to a lesser extent of flu right now in Australia at the moment.
Well, the AMA has come out and they said, quote, no time for vaccine complacency, unquote. And that's certainly talking about not just the flu, but as you mentioned, with COVID cases increasing. What is the latest with COVID and the 5th Omicron wave?
Well, there's no doubt we're into the 5th wave, but if there is any good news in this, each wave has been less than the one before. So Omicron has been mutating. It's evading our immune system so it can reinfect people and then get COVID a second time. But it's less common and somewhat less severe. Having said that, there's tens, if not hundreds of people dying every week.
The Department of Health and Aged Care recorded 17,277 flu cases between May 15 to 28, which was more than double the previous fortnight's total. So certainly seeing an increase in flus as well. Now, we've spoken about this before in terms of the vaccination. It doesn't cover all types of flus.
No, it doesn't. But, you know, there are 2 types of A and 2 types of B in the flu vaccine. So it is moderately protective. It's just that it doesn't work for everyone. And let's be honest, nothing's perfect. But I was happy to have been vaccinated. People who are vaccinated, were they to get flu, even so, tend to get it less severely. I've had a bit of a dose this week. I've been at home resting up. But flu vaccination is certainly worthwhile. It's just not perfect.
And would you recommend the flu vaccination for all ages?
Yes, there's very good evidence that the very young and the very old and those with major chronic medical problems benefit the most. So children from 6 months of age to 5 are especially able to get a free vaccine. People 65 and above and those with chronic medical condition can all get a free vaccine. The other thing the AMA has said, and I agree with them, when you go to your GP and book in when you can get flu jab in one arm and COVID jab in the other if you haven't had a COVID jab for the last 6 months. And again, the AMA point out that half the Australian population haven't had a COVID jab for more than 6 months. So the vulnerable ones, as I've said over and over, are the ones who would most benefit and, ring up the GP, book yourself in.
And we are hearing a lot of people with, severe conditions from COVID and also the flu, which we certainly have seen over many years. In terms of when you're infectious with the flu, how soon are you?
Yeah, it's important that people realise that in the day before you become symptomatic with a runny nose and a cough, you're already you're already infectious and you're already spreading the virus. So, you can prevent some infection by isolating once you're sick, but the key thing is not to be doing presenteeism, going to work, soldiering on, but absenteeism and working from home. The other key thing is that if people do get sick and they know they're not a well person already, book into the GP early and get a test, and you could be tested at the same time for both flu and COVID, as I was by my excellent GP this week. And if you've got one or the other, you can get an antiviral from your GP, which is specifically effective against flu or specifically for COVID. So there's a number of things that you can do. It's impossible to prevent transmission of flu or COVID but you can reduce it by the measures I've mentioned already.
And what about some other illnesses that we're seeing through the country?
Yes, we've seen a bit more whooping cough, and that's on the rise. And the thing about influenza, which is rising right now, is it stirs up the lining of the throat and allows bacteria, which are sitting there quietly, to invade. And there's several really severe bacterial diseases that are on the surge. Group A streptococcus, pneumococcus, which causes pneumonia, meningococcus, which causes blood poisoning, and meningitis. So these things are, with the winter, increasing again. And so if you can avoid flu, you might also avoid secondary bacterial infection as well.
And talk us through the immune system. If you perhaps just coming off a bout of the flu, does that increase your immune system? What are the things that we hear that are perhaps true and not true?
Well, viral infections generally suppress your immune system. They work against your T cells and your antibodies, so you're actually at risk of what I've described already: secondary, subsequent bacterial infections, with a number of viral infections like EBV, glandular fever, it can suppress your immune system so that you get chronic fatigue. That's most common with EBV. It can occur with other viruses like CMV and sometimes with flu. And of course, you can get long COVID, where symptoms of fatigue and brain fog and muscle ache can last for 3 months or more after COVID. The viruses get you in the short term, but they can also, to a lesser extent, cause damage in the longer term.
And I guess, looking at perhaps someone just having a common cold as opposed to the flu, what are the different symptoms there?
Yeah. Well, to start with, they both look the same. They're both feeling a bit off colour, a cough, maybe a headache, a runny nose, a fever. But it tends to be that flu is more severe. It can knock you out, so you really don't want to get out of bed. And so you tend to have more severe symptoms with the flu, but a lot of them overlap with the common cold. So if you're getting progressively severe symptoms, that's when it's a good idea to check in with your GP as to what might be the cause and what might be the best treatment.
And some people have their own sort of home remedies. What are you doing for yourself, Professor, to stay well, besides the antivirals, of course?
Yeah, well, rest and hydration. And my GP gave me an antibiotic, which I stopped once it was confirmed it was flu, because I didn't need it. So there are antivirals for the virus and there are antibiotics for bacteria. So they're different things. And sometimes you're more likely to be prescribed an antibiotic when you actually need an antiviral.
Always appreciate your time and expertise, and recover well. We'll talk to you again soon.
Thank you very much.